Good afternoon, everybody. This is Congressman Mike Levin. Thank you so much for joining us once again for another virtual town hall on COVID-19 and so much else that's going on. We're grateful that you're here, whether you're on Facebook or Twitter or YouTube. I hope that the next hour and a half or so is informative. And as always, we really appreciate all the questions that you asked us throughout the week. We'll get to as many of them as we can. And before we begin, I want to offer sincere condolences from both Chrissy and myself to the families and friends of the young Marines and sailor who tragically lost their lives as a result of the amphibious assault vehicle accident off the coast of San Clemente Island on July 30. I know that multiple investigations are ongoing to determine exactly what caused this incident and to prevent it from happening again. And I hope it provides us an opportunity to just pause and reflect on the sacrifices made not only by those Marines and sailor, but by all who serve this country and put themselves in harm's way in order to protect our freedom and to keep us secure. So our condolences to those families and those friends and to all at 1MEF and everyone at Camp Pendleton as well. With that being said, I want to introduce two very special guests this week. First, I'm excited to welcome Ms. Benita Cooper, a partnership specialist with the U.S. Census Bureau office in Vista, who's going to talk about how important it is that everyone, and I mean everyone, in our district completes the 2020 census. Benita is also a constituent. I'm very honored to have her as a constituent and a United States Marine Corps veteran. And we're very proud to have her on our town hall today. Thanks for joining us, Benita.
My pleasure. Thank you, Representative Levin, for providing this platform for us to educate and communicate with the public. I appreciate it.
Fantastic. And just to remind everybody, as mandated by the U.S. Constitution, everyone living in the United States is to be counted every 10 years. And the census isn't simply about taking a head count to determine our state's representation in Congress, although it does do that. It affects so much more in our congressional district. With an accurate community response, the 2020 census will distribute literally billions of dollars of federal resources to local schools, hospitals, first responders, cities, roads, and more to help us better serve you. And the results will also inform how much federal funding will be allocated into programs like Medicaid, Head Start, and SNAP, which are absolutely essential for the most vulnerable families in our region. And given how important it is to have a full and accurate count for the census, I was very troubled to see the Trump administration's announcement just this week that the census count will end 1 month earlier than planned. And later on, as Benita and I answer your questions about the census, I know we'll discuss that issue a little bit more. Next, I want to introduce our other special guest, Dr. Kimberly Brower, a professor and infectious disease epidemiologist at the University of California at San Diego. Go Tritons. Good to see you, Dr. Brower. Dr. Brower earned a PhD in molecular epidemiology from Johns Hopkins University and was a fellow with the U.S. Centers for Disease Control and Prevention. So I am very excited to hear from Dr. Brower on COVID-19 and what we need to do to get this virus better under control. Thanks for joining us, Dr. Brower. Appreciate having you.
Yeah, thanks so much for inviting me and for creating these great forums for the public.
Thank you. I think we've done about 3 dozen of these since the pandemic started, so we're really honored to continue doing that. And it's been another very difficult week with regard to COVID-19. Sadly, we passed 157,000 who have tragically lost their lives as a result of this virus, and it's just a heartbreaking number. The U.S., as I'm sure you know, has the most confirmed cases of COVID in the world, 4.8 million and counting, soon to hit 5 million, and as I mentioned, 157,551 deaths. California has the most cases in the United States, 527,000 and counting, and 9,709 deaths. San Diego County now has exceeded 30,000. There are 30,515 countywide. That's where we are, and 568 deaths. Orange County, 38 1,066 cases and 653 deaths. State and local officials are watching the figures very closely as we are, particularly to weigh how and when to reopen. And one metric is whether counties have kept the number of new cases reported over the last 14 days to less than 100 per 100,000 people. That's an important number. Unfortunately, both Orange and San Diego counties fail that metric. Over the last 2 weeks in San Diego County, there has been 5,996 new cases confirmed. That amounts to 182 per 100,000. Remember that the limit is 100 for the state reopening guidelines. And in Orange County, there has been 7,090 cases in the last 2 weeks, and that amounts to 224 per 100,000, so still over double that threshold. Most of the state continues to be on notice. The conditions have prompted the governor now to have the watch list include 38 counties, and that accounts for 97% of the state's population. Deaths, unfortunately, continue to climb. A new single-day death record was set last week. Some potentially good news is that fewer tests are coming back positive in California over the last 14 days. The statewide positivity rate is around 6%, but this decline may not be accurate. Just yesterday, the top public health official said that the state's data system used to process the test results is marred with technical issues. So we're keeping a close eye on that. The reopening, as you know, is rolling back. The governor has returned to stricter lockdown. Masks are required across the state. And on July 17th, the governor announced that schools located in counties that are on the monitoring list, which includes Orange and San Diego, would not be able to physically reopen for in-person instruction until their county has come off the monitoring list for 14 consecutive days. And that's when they can begin in-person instruction if they follow very strict guidelines around masks, physical distancing, regular testing, and dedicated contact tracing. On Monday, the California Department of Public Health issued additional information on what it would take for elementary schools to open for in-person instruction in counties where they would otherwise be closed. And the new requirements are pretty extensive, and county public health directors will have some latitude. However, the state intends to prohibit any exceptions in counties where the numbers of infections are more than 200 per 100,000 population. So that's twice the rate of 100 per 100,000. And per the earlier numbers I mentioned, San Diego would meet that threshold at 181 or 182. Orange County would not at 224. So this is another number we're going to have to keep a close eye on, particularly as Orange County elementary schools may consider in-person instruction. And the other thing to mention is that on Monday, state public health guidance said that some youth sports will be permitted. School-based and club sports will be permitted if 6 feet between individuals can be maintained with a stable cohort of participants, such as a class of students. Sports and other outdoor activities that require close contact will not be allowed. The state, as I mentioned before, has set aside $5.3 billion in additional funding for distance learning and new requirements around distance learning. And as I've said, this is very significant for our family. We have 2 young children at home. And the best thing we can do, again, is to get our state under control and to get our counties off the monitoring list. So that means getting that rate of infection down as quickly as we can. And the way we do that, we know how to do that. Wear our masks, socially distance, only go out when we have to, adhere to those public health guidelines, and we'll get there sooner than otherwise. I'm going to continue to do everything I can for our district and for our country to get back on track. And for the last couple of weeks, I was in Washington, where we got a lot of things done, but I want to reiterate how frustrating it has been that we have not been able to get that 5th COVID response bill over the finish line, particularly so because now 11 weeks ago, we passed the HEROES Act in the House, 11 weeks ago. And for the last 11 weeks, Treasury Secretary Mnuchin Mark Meadows, White House Chief of Staff, Mitch McConnell, they did very little, if anything, as evidenced by the fact that they couldn't even get a proposal where a majority in the Senate would vote in favor of that proposal. Their HEALS Act that they introduced about a week ago now doesn't even have the votes in the Senate. So I'm tracking it, obviously, very, very closely, and we're going to stand firm on many aspects of our proposal. And it's so difficult because what is at stake? Millions of children are food insecure. Millions of people are at risk of not being able to pay their rent or their mortgage. Millions of Americans now, for 19 weeks in a row, at least 1 million Americans have filed for unemployment insurance. And of course, our GDP saw the biggest quarterly drop on record, that 32.9% drop, which was just stunning. And we need a scientific approach, a robust approach, where we follow the public health advice and the experts, and we do everything we can to crush this virus. And as I've said time and again, we cannot have a healthy economy unless we have healthy people. And it's so important that we follow the science first. And that's what our HEROES Act did, a bold and comprehensive strategy. And it's just simply unacceptable that McConnell and the administration have failed to act, now going on 12 weeks, where their pause, their delay has cost lives, has cost livelihoods. And we have to get to that solution. And we're ready on 24-hour notice to go back at any time to Washington, D.C. so that we can vote on that solution. We've been having daily discussions, both Zoom and over the phone, talking about the key aspects of it in the negotiations. As a reminder, this is the fifth bill. We passed 4 earlier bills all the way back to the beginning of March, $8 billion for the development of a vaccine. I think that was really important as we see all the good things happening with regard to that vaccine work. Also, middle of March, the family's first bill, $200 billion for nutrition assistance and for emergency sick leave and to support Medicaid. Very important bill as well. Then there was the CARES Act, end of March, $2.2 trillion, direct cash payments of up to $1,200, expanded unemployment insurance, $600 a week, and so many other provisions. The Paycheck Protection Program, which has been a mixed bag, but the first tranche of funds for that. And then lots of money for our hospitals, some money, though not nearly enough for state and local government, $150 billion. Most of it here has been spent. You know, I hear some of the folks like McConnell say we could just use the existing funds and make them more flexible. But that doesn't work if the funds are gone. And in California, particularly in Orange and San Diego counties, most of that money is not available, has already been accounted for, and more money is needed. Our state, local, county, tribal, territorial governments, they are hemorrhaging money. They are hurting. In our district alone, 9 cities, 9 mayors, other than the city of San Diego, 9 mayors, 6 Republicans, 3 Democrats, all agree we need additional support from the federal government, such as that provided in the HEROES Act, specifically for smaller cities like Oceanside, Vista, Carlsbad, and the rest in our district that receive no direct federal funding as part of the CARES Act. So it's critically important. The fourth bill that we passed was basically an additional amount of about $500 billion in funds for the Paycheck Protection Program, for hospitals, and for testing. And here we are. It's now the beginning of August, and we still do not have a comprehensive national testing strategy to this day. It is simply unacceptable. And we're going to keep pushing and fighting for that and so much more. The $3.6 billion for election security, the $25 billion for the United States Postal Service, so critically important. And what we're seeing from Louis DeJoy, this appointee from the president, huge donor to the president's reelection, what he is doing to undermine our Postal Service. When you think about the life-saving medications that aren't being mailed out in certain parts of the country, particularly to our veterans, that's where all the VA medicines are distributed through the USPS. And remember that a lot of the problems with the USPS started with a law that Congress passed and President George W. Bush signed all the way back in 2007, which capped revenues and also obligated 75 years of prepaid pension liability. That is why the U.S. Postal Service is on shaky financial footing. I was proud to lead an effort of 137 of my colleagues, a bipartisan effort, to ask once again to leadership of the House and Senate to include that lifeline for the USPS, particularly in this election year when we hear unfounded critiques from the President of the United States on voting by mail, where we know that there is no evidence whatsoever to support the President's assertions, claiming that there are somehow systemic problems with vote by mail. The President says he likes absentee voting in Florida, probably because he does it, but he doesn't like vote by mail. But it's the same thing. It's the same thing. Now, some states are going to have to ramp up their efforts, and that's why they need the money to do it. And that's why we have $3.6 billion in our HEROES Act to provide that support. Now, that is a number that the nonpartisan Brennan Center at NYU Law School said was necessary to secure our elections during this pandemic. We've got to hold the line on that. A couple of things I'll mention. When it comes to the Paycheck Protection Program, we did get some data on the PPP. We put $670 billion in. It has helped a great deal in our district. Over 20,000 PPP loans were granted, 20,456, and that's more than $613 million in federal funding. Those companies that received the PPP funds, they have between them 241,000 employees, so a significant number, obviously not all living in our district, but many of them are. The downside, obviously, is that some companies that should have got PPP loans did not get the loans, and others that really didn't need that money took advantage of the situation and got the loans. And any future small business lending that we do should not be for the wealthy and the well-connected. It ought to be for those mom and pop businesses that truly need the help. The other thing is, in the middle of this crisis, we still have those in the administration who are attacking the Affordable Care Act, and specifically the health care coverage that is so vitally important during this pandemic. We know millions have lost their employer-provided health insurance. We know that at least 500,000 have applied for the Affordable Care Act exchanges during this pandemic. And 47,000 people alone in our district rely on the ACA. So the fact that the administration would try to undermine protections for those with pre-existing conditions and the healthcare that is so desperately needed during a pandemic is simply unconscionable to me, and we're going to fight it every way we can. Very briefly, two other things, actually some good news. One is that the president signed into law the Great American Outdoors Act. This is a huge deal. It provides $900 million a year in perpetuity for the Land and Water Conservation Fund that helps all of our great state and local parks. If you care about Carlsbad State Beach, Torrey Pines, San Clemente, San Onofre State Beach, all of those have received LWCF funding, about $2.5 billion in California of LWCF funding. In addition to that, a $9.5 billion backlog at our national parks will be filled. That's just a great bipartisan win. I have to remind my friends and colleagues across the aisle that it was Democratic votes in the Senate that got that over the top. Only about half of the Republican senators voted for that. That's the same in the House. It passed on I believe, a 310 to 107 vote in the House, a 73 to 25 vote in the Senate. But it's law now. The president signed it. That is great news. Moving forward, we might actually have parks, national parks, that we can be proud of for generations to come. The other thing I'll mention is that last week we passed the National Defense Authorization Act, actually 2 weeks ago now. It included $105 million in federal funding for Camp Pendleton. I was so excited about that. Additional money for the Naval Research University initiative, and that is very important for UCSD, the collaboration they have with the Navy there. And it also includes amendments that I supported for our veterans, such as the HUD-BASH voucher program being more widely available, and a 3% pay raise for our troops. So I was very happy to see that. And finally, we had a big bipartisan win about a week ago Monday with the Cools Act, the Ryan Cools and Paul Benning Specially Adaptive Housing Improvement Act. That's going to the president for his signature after having passed in the House in 2019. Took about a year, but the Senate finally passed it in 2020. They sent it back to us with some revisions. We passed that revised Senate version, sent it to the president for his signature. And it's a bill by Gus Bilirakis of Florida and myself. Gus and I work very closely together. I'm the chair. He's the ranking member of our subcommittee on Veterans Economic Opportunity. And what this bill would do is improve the Specially Adapted Housing Grant Program, providing money for veterans with certain permanent service-connected disabilities. And it increases funding, increases the number of applications VA can approve, extends the benefits to more veterans, and allows those eligible to access the funding up to 6 times instead of 3. So if you move or you get a different car where you need to adapt the vehicle or the home, this bill will allow you to do that more frequently. Last week, I also supported our Water Resources Development Act, and it included some great wins for our coastal communities, specifically the Del Mar Bluffs, Oceanside Special Shoreline Study, and the Encinitas Solana Beach projects as well. So very excited to keep working with the Army Corps. We just passed the 1-year anniversary, tragically, of Dr. Pat Davis losing 3 of his loved ones at Grandview Beach. We're going to do everything we can to continue to work very hard for protecting our bluffs and our coast. The last environmental thing I'll mention, if you have not seen it, I hope you check out our San Onofre Task Force report. It's about a 70-page report. You can check it out on the Samuel Lawrence Foundation website or on mikelevin.house.gov, and I hope that you do that. It has 8 key recommendations about how we deal with spent nuclear fuel, not just at San Onofre, but really all throughout the United States. So lots going on. Grateful to be with you. And with that, I'm going to hand it over to Benita Cooper for her opening remarks about the census, and then we'll hear from Dr. Brower about COVID-19, and then we'll get to your questions. Benita, the floor is yours. Take it away.
Thank you, Representative Levin. Well, as we all know, it's census season. Census Day, National Census Day was on April 1st of 2020. And hopefully we all understand the importance of participating in responding to the census survey. When you respond to the census survey, it boils down to the allocation of funding for your local school district, your fire department, your police department, for infrastructure. It's vital that everyone gets counted, no matter what your status is, what your race or ethnicity, or your gender. Everyone is important. The census belongs to all of us. And our agency, the United States Census Bureau, we aim to count everyone once, only once, and in the right place.
Excellent. And Benita, you were telling me before we got on the air that we're doing well in California, and we're doing extremely well in the 49th district. And I think we're about to hit a milestone of 70%. Isn't that right?
That's correct. Currently, the state of California sits at 63.1%. The national level, nationally, it's at 63.1%. The state of California is at 64.4%, and District 49 is at 69.6%. We're just 4.4% away from 70%, and I am confident that after this town hall, we'll be at 70% because everybody's going to spread the word and everyone's going to share this town hall with their friends and family members.
Absolutely. So we can get Benita over 70% just from those watching if you haven't already filled this out. And it's just census.gov, right? And everybody should have been mailed that form. Boy, it seems like a few months ago now.
Yes.
But if for whatever reason they don't have the form anymore or anything else, what do they need to do? Just go to census.gov?
They can actually go to 2020census.gov. That's 2020 census, CESUS.gov. Or they can call the local line. The local number is 619, get the number correct, 619-695-5657. We have census employees that are readily available to answer your census questions and to guide you through how to respond either on the phone or online if you have not received your survey at this point in time.
Fantastic. Well, I know we've got a few questions about the census, so we'll get to those in just a minute. But before that, obviously, Dr. Brower, what a difficult time this is. It seems like, it's almost like Groundhog Day, where we've seen the rising infection rate and the death toll and the hospitalizations now tick back up. It looks like there may be some positive news with regard to the 6% positivity rate, but now even that has been thrown into some doubt, I guess, yesterday, based on some of the potential problems in the data and the way the state is reporting it. But there's so much going on, and I'd love to hear from you, just your opening take on where things stand, and then we'll have plenty of time for follow-up questions. So the floor is yours.
Great, and thanks again for having me and giving me some time to go over the latest statistics. As you mentioned, this past month has been really difficult in regards to COVID. We've seen cases rise in a number of counties throughout California, and we're still, well above what we're aiming for. As you mentioned, that 100 case rate per 100,000 population. To give you some perspective, a lot of the countries that have successfully opened to some extent, at least opened their economies more, have brought things down well below 25 cases per 100,000. So I know we're shooting for 100, but really it'd be great to see us far below this number. But there have been some encouraging trends just over this past week. Like you said, numbers fluctuate, and it's hard to know just how excited to get about them. But with this positivity rate, so the lower it goes, that means that the more successful we are at reaching people who are positive. Some countries have really high positivity rates right now, like 20%, and that means that they're probably missing a lot of cases. So the people who do come in are very likely positive, whereas ours is now, it appears to be below this threshold that CDPH wants us to have of 8%, but it's probably somewhere in the margin of error right now. Other encouraging news is that hospitalizations, at least in San Diego, have plateaued, and in Orange County are starting to go down a bit. We do still have a number of outbreaks that have been identified. In San Diego in the past week, they had 32 identified outbreaks where they could trace transmission in particular settings. One was in a fitness club, and this is way over the number of outbreaks we're hoping to have. But at the same time, it really reflects that the public health system in both Orange County and San Diego County have hired a lot more contact tracers and are getting more effective at finding outbreaks and addressing them when they do happen. Another piece of good news is that our hospital system capacity remains quite stable. So we have sufficient ICU space as well as ventilator capacity in both counties. So hopefully we've reached a bit of a plateau and we'll start to go down from this rather high peak. We have a long way to go, but I think these encouraging numbers are probably reflecting some hard work on getting more people to wear masks, to be mindful of physical distancing, to also move non-essential activities such as dining and gyms outdoors. I know how much extra work that is for those types of businesses, but it really makes a big difference. So I hope to see in the coming weeks that we'll continue to see things go down. And I also hope that all these additional public health workers that the health departments have hired will be something that maybe will outlive the pandemic, because for a long time, our public health departments have kind of been operating on a shoestring budget, and it'd be so nice to have prevention up forefront rather than reacting to things after they happen.
I completely concur with that, Dr. Brower, and I think from all the reading and research and things I've seen and heard, it seems to be a cyclical thing. Every time there's a pandemic, we need to react, and we're not as proactive as we need to be in the subsequent years to put that foundation in place. Of course, the prior administration did put some of that foundation in place, but then a lot of that was gutted in 2017. So hopefully we can learn from that lesson, and we can set that foundation anew. That would be my hope. We've got lots of questions, and we'll get through, again, as many of them as we can. Some of them are for the doctor, including the first one for Dr. Brower. This is from Elaine. Please ask the doctor if it is advisable to close down counties that do not get off the watch list after month-long data showing no progress on slowing down the COVID-19 infection rate.
Oh, that's a great question, Elaine. Yeah, part of the reason for this resurgence was likely some places may have opened too soon, or the public relaxed a bit in mask wearing and social distancing. And you're right, closing down would probably be the fastest way to reverse troubling trends. But really, the decision to do so at a county level needs to be informed by a variety of metrics. So I spoke earlier about some of our numbers, and we're comparing them to state levels. And of course, if a county has numbers that are way beyond the thresholds and that are continuing to rise, then they might be limited to, not having other options besides closing down. If you think of an epidemic as a leaky pipe, closing down would be like turning off the water. So it's kind of an emergency action to take. It's very effective, but unless you have, once you've closed it down, unless you have the tools to repair that pipe so that you're working on contact tracing and ramping up testing ability, as soon as you turn the water on again, you're just going to have it leak all over again. So I'm hoping that instead we'll consider other factors. If you, for one thing, if you do have to turn off the water, metaphorically, that you have bottled water for people. So you have, in our case, economic incentives to help people actually stay home and not be tempted to go out too soon or turn that water on too soon. But really, it's universal masking and physical distancing. It's not going to completely stop this leak, but it's the way to decrease the water flow and kind of prevent a lot of damage. So my hope is that instead of having to do a really blunt measure like completely closing off certain counties, that instead we can really work on promoting masking and increased physical distancing, sanitation, and some of the creative ways that people are already keeping businesses open by moving outdoors as a way to keep things under control and get those numbers down as much as we can without going to the extreme measure of closing.
Thank you so much, Dr. Brower. I will remember your leaky pipe analogy moving forward, and it seemed like back several months ago we shut the water off, but there were still holes in the pipe, and we got some duct tape or some chewing gum or what have you, and it didn't hold so well. So hopefully we've learned from that experience. Here's one for you, Benita. This is from Monica in Oceanside, who asks, I responded to the census, but what should I do to make sure that my neighbors respond too? Great question.
That is a great question. Well, our agency encourages you, the public, to encourage your neighbors to respond by letting them know the impact of responding, which we discussed previously. Initially, we discussed how it affects funding, allocation of funding for different areas in your local community. These are just a few of the examples: the school, fire department, police department, infrastructure. If you know someone that's on the fence about responding to the census survey, please encourage them to use our user-friendly website at 2020census.gov. The public can call that local number. I'll repeat it again. It's 619-695-5657 for assistance with completing the survey. And we're just here to We can dispel any negative notions that anyone has about responding to the survey. It's easy, it's fast, and it's secure. Regardless of your race, ethnicity, or your status, everyone counts. So it's very vital that we get everyone in the community counted.
Thank you for that. And it's very easy, right? It only takes, a couple minutes to fill out?
Takes about 2 or 3 minutes.
2 or 3 minutes. Everybody has 2 or 3 minutes.
Exactly.
And I do know that your timeline has been accelerated some.
Yes,
so
it has.
You want to speak to that for just a second? Talk about what that means?
Yes. The U.S. Census Bureau, we continue to evaluate our operational plans to collect and process U.S. Census data. We plan to hire more employees and include enumerator awards to accelerate the completion of our data collection and apportionment counts by our statutory deadline, which is December 31st, 2020, which is required by the Secretary of Commerce. The Census Bureau new plan reflects our continued commitment to conduct a complete count and to provide apportionment data and to protect the health and safety of the public and our workforce. We plan to improve the speed of our counts without sacrificing completeness. As a part of our revised plan, we will conduct additional training sessions and provide awards to enumerators in recognition of those who maximize hours worked. We are confident that we will carry out a complete decennial count in 2020.
All right, that sounds good. Well, with the help of the people watching, and if we pester our neighbors a little bit, that'd be good. But appreciate all your good work. Here is Nick and Dana Point, basically has that same question. I heard the census is going to stop counting people a month earlier than they had planned, and that could lead to a significant undercount of poor communities. Do you want to just address why is this happening? Why are we having to do this?
Well, this is a mandate that was, it's a mandate that we have to adhere to. And as the U.S. Census employees, we are obligated to provide accurate statistical data for the public. Like I stated before, we're going to maximize the hours that our employees work. We're going to provide a complete and accurate account, although we're going to stop the count on September.
Oh, I think Benita may have froze up. We will turn to Dr. Brower for our next question. And this is from Claire, Dr. Brower. Why is hydroxychloroquine, very controversial, hydroxychloroquine, an over-the-counter drug in many countries, but not the United States? And perhaps if you want to speak generally to hydroxychloroquine, as it's been in the news a lot over the last several months.
Oh, that's a really interesting question. So yeah, for anyone who's traveled to other countries, you may have noticed that, antibiotics, a lot of drugs that aren't available over the counter here may be available in other countries, or it's just a matter of going straight up to the pharmacist and requesting it. So it seems a lot more convenient in some countries. So you might wonder, why in the US do we have these restrictions? And back in the 1950s was when the US divided drugs into two different classifications, prescription and non-prescription. And there was a really good reason for it. The prescription ones were the ones that had a high potential for misuse or abuse, or they were really specific for certain conditions that were difficult to self-diagnose. Maybe they had some safety issues that required careful monitoring of a patient, or in the case of antibiotics, resistance was a big concern. So if you think about hydroxychloroquine, it's used both as an antiparasitic drug to treat malaria and as an immunosuppressant to treat lupus and arthritis. So it really, as far as what makes it a prescription drug rather than over the counter, is that it's really specialized for conditions that are difficult to self-diagnose. Also, the drug as the representative mentioned, has been in the news a lot in regards to its potential to treat and prevent COVID. And the reason for this, it made sense at first because there was early lab data and a few small observational studies that suggested it might be efficacious. So it was a good hypothesis and it deserved more testing and exploration. And in fact, even a number of groups at UCSD began to conduct randomized clinical trials of hydroxychloroquine along with azithromycin. However, thus far, larger trials of thousands of people with mild to moderate COVID-19 have found no effect. In fact, one trial was stopped early because it showed a slightly negative effect. Based on all of this data thus far and the size of these studies, both the WHO and the NIH have decided to stop their hydroxychloroquine studies. And in fact, the FDA revoked its emergency authorization to use hydroxychloroquine in clinical settings. So I guess it was good that hydroxychloroquine is a prescription drug, that we didn't have a lot of people going out and kind of being a clinical trial of one and testing it for themselves. Instead, people really explored the safety issues. In addition to being ineffective against COVID, they found that heart, liver, and kidney problems were some of the side effects. And in some cases, it was quite severe. So luckily, we have these randomized clinical trials that have informed us. We've explored these early hypotheses, but now we can move resources to more promising drug candidates.
Excellent. All right. Thank you for clearing that up once again. I hope people are listening loud and clear. Benita, we have another one for you. This is from John, who asks, what happens after the census counting is done, and when should we expect to see final results of the census? Oh, Benita, I think we lost you.
Oh, hello. I'm sorry about that. Am I on now?
I think your screen, you're on not on landscape. Can you? There we go.
Is this better?
That works. There you go. Don't touch your iPad.
I apologize.
We got you. Go ahead. So what happens after the census counting is done? When should we expect to see final results of the census?
Once we have all the data collected from our self-response and our field data collection in our secure system, we plan to review it for completeness and accuracy, streamline its processing, and prioritize apportionment to meet the statutory deadline. The dedicated men and women of the U.S. Census Bureau, including our temporary workforce deploying in our communities across the country in upcoming weeks, will work diligently to achieve an accurate account. The initial estimates will be ready on December 31st of 2020. In June 2021, we expect to deliver the count to the states so the states can either contest or approve our count. In March of 2022, the official numbers will be released, and that kicks off the redistricting process.
March of 2022, okay.
Yes.
Here's one from Marianne in Carlsbad. What will you do to promote that the next stimulus bill goes to those who have lost their rent relief and eviction moratoriums? Marianne, that is such an incredibly important question. And the numbers that we've seen around those who are at risk of eviction, those who are at risk of foreclosure, beginning the mortgage delinquencies, very, very troubling. And so we've got a number of efforts underway that I hope make it into the final package. We're certainly going to fight for it. The HEROES Act included $100 billion for emergency rental assistance. And that was from a bill that I co-sponsored, H.R. 6820, the Rental Market Stabilization Act. So $100 billion. And then on top of that, another $75 billion in the HEROES Act in assistance for homeowners for mortgage payments, as well as property taxes, property insurance, utilities, and other housing-related costs. My understanding is the HEALS Act, the Mitch McConnell bill, had zero for any of this, for emergency rental assistance or for help to homeowners. Pretty hard to shelter in place if you don't have anywhere to shelter. So pretty basic stuff. And I've also written to House leadership and Senate leadership, along with many of my colleagues, asking for this specifically to be included. So I'm very hopeful that this bill that is being negotiated as we speak will include this important emergency rental assistance and stability for homeowners. Maryland says the obvious way to stop the spread of coronavirus is to enforce the mandates. Wearing masks and no large gatherings are at the very least. Why aren't we enforcing these mandates with fines? Well, I'll begin, Dr. Brower, but I think many of our law enforcement agencies have decided that it's just unworkable for them to enforce these mandates. Not all of them, but they're trying to gain voluntary compliance through education. Unfortunately, we've seen violations. These violations, in most cases, are misdemeanors, may be punishable with a fine. I did read this morning that the County of San Diego just moved forward with a plan to spend, I think it was $1.8 million to hire 22 new people to help with enforcement, whether it be businesses or otherwise help with enforcement of the COVID-related orders. And it's difficult, very difficult, to cite every individual not following the mandates. The California Division of OSHA, Occupational Safety and Health, and also Alcoholic Beverage Control, they've been working to enforce compliance specifically among businesses they have jurisdiction over by sending out inspectors, issuing citations, and the rest. And one of the reasons we do these events is to try to circulate good information and remind our constituents of the importance of following these public health guidelines, wearing the mask, socially distancing, etc. And Dr. Brower, it'd be great if you could explain once again, because I feel like we've done like 37 of these and we probably had to explain this 37 times. Why are these guidelines so important?
Right. Until we have an effective vaccine or treatment, really masks are one of our best tools in this fight against this airborne infection. Fully 40% of persons infected are asymptomatic. And so you may feel perfectly fine, but you're helping to continue the length of this pandemic. The virus can be spread just by breathing, but all the more so if there's an interaction that involves talking or heavier breathing, such as while exercising. So, and the virus can linger in the air for some time. So you may go into an indoor space that seems, no one's within 6 feet of you. But if there isn't a lot of ventilation, it's an enclosed environment, you could still be exposed. So really, masks are essential. A recent study out of Germany found that face masks reduce the daily growth rate of reported infections by around 40%. And a lot of the countries that really have adopted universal masking have really brought down their case rates and been able to really open the economy to the extent that I know we're all dying to do. So I hope that everyone will see that this is a cheap, low effort thing that all of us can be involved in. And we got the scientific evidence backing it. So I can't repeat enough that masks are really essential.
Thank you, Dr. Brower. Appreciate that. And it is unfortunate that we have to keep saying this every week, but wear your mask and socially distance. It's not a political statement. It's about basic common sense. And that's all we need to do. Next, Terry in San Clemente says, I appreciate your support of the HEROES Act. The Senate has added the Trust Act to the Republican version of the stimulus, which means that the McConnell bill, called the HEALS Act. The Trust Act creates a closed-door commission to fast-track Social Security and Medicare cuts. The stimulus is created to help people during the pandemic, not to possibly cut benefits in Medicare when people need it the most. Will you stand against this attack on Social Security and Medicare? Terry, count on it. I will not support anything that undermines the Social Security and Medicare benefits for seniors, period, end of story. And it's a non-starter with my colleagues as well. Shirley asks, since the schools were closed for 3 months, why do they need further funding for opening? Well, Shirley, I have asked that question or similar question of all of our superintendents from our school districts. And what they've told me is that they need a lot of additional equipment, whether it be greater use of technology for distance learning, or any of the other things that are needed to get their campuses ready logistically to be able to adhere to the social distancing and the mask wearing and all the rest. Could mean things like temperature, whether it be simple thermometers or scanners, and all of these things bear a cost. The cost, the estimate of one of our school district superintendents was in the millions and millions of dollars. Even a bare bones version still costs significant sum of money. So if we're going to require or demand, in the president's case, that schools reopen, they need resources. I think they only should reopen when it's safe to reopen, and we ought to give them the resources to do it. Rather than making demands, we ought to be thinking about the health of the students and the teachers and the administrators at these schools. And so that'll be at the top of my mind. Josh in San Juan Capistrano says, it seems like we're only going to get back to normal once there's a vaccine. Any updates on when that might be ready? And Dr. Brower, I know that's on a lot of people's minds, and Operation Warp Speed being what it is, and all these interesting trials of these new sorts of vaccines. But where do you see things now, and where do you see things winding up?
Yeah, good question, Josh. Something big like a vaccine or highly effective treatment is, what we urgently need to get back to normal. And I know we all can't wait for that. But right now, what we have so far is, as far as vaccines, we have a collection of animal data that looks quite promising. We have some early safety data. So we have a number of candidates that didn't harm people. So that was promising. And they created an immune response. So again, both promising things. But now comes the hard part. We need to check to see if these vaccines actually work. And it's thought that the earliest we'll find out will be early next year, or if we're lucky, the end of this year. A number of companies such as Moderna and Pfizer have what's called phase 3 efficacy trials, and they're trying to recruit 30,000 people for these trials. And as you can imagine, you can't do that overnight. And once you do recruit them, you have to follow them over time. So you give them the vaccine and you wait to see, who unfortunately will get infected with the disease. And it takes some time. But it is going at warp speed compared to prior vaccine developments for other diseases. For instance, a word of caution, the HIV vaccine was promised to be ready and available by 1986, and we don't have one yet. The vaccine for Ebola took about 5 years to develop, the first candidate. So it's getting faster all the time, but phase 3 trials don't always pan out. So if it doesn't pan out by the end of this year, then they'll have to try new formulations and then go for another phase 3 trial of other things in the pipeline. The other concern is once they do have a good vaccine candidate, they'll have to spend a number of months to manufacture and distribute. It could take really a year before everyone who wants to get vaccinated is vaccinated. But some things to look for when you hear the news about these early trials is how effective the vaccine is. Some will be hoping for something that prevents from getting the infection at all. But if it doesn't, could it at least lead to milder symptoms? That would already be a success. For the US, we're hoping for a vaccine that's at least 70% effective. So it may not protect everyone, but if enough people take it, a 70% efficacy rate would help slow down the pandemic. One final thing is they'll be looking for in these early trials to make sure that there aren't too many side effects, and that's what they're being very careful about. Why not just based on phase 2 give everyone a chance to be involved in these early trials? And they really want to make sure this is safe and effective before scaling up, because it's really costly to roll out a vaccine, and diverting attention from everything else to vaccines means that we don't have resources for other things that we know work, like at the moment, contact tracing and things like that. So they're doing a moonshot, and let's be hopeful that coming probably the beginning of next year, hopefully we have something in the pipeline.
And Dr. Bauer, for that phase 3 trial, how large of a sample do they normally go with, and what percentage of efficacy is needed for it to pass the phase 3?
So they usually want 30 to 50,000 people. And the reason why they want so many is not just to know that it works, but they'd like a diversity of people. They don't want just young people or just old people. They want, or just one particular ethnic group. They want to see that it works in the general population. So it's very important that the public be willing to try it out and help this effort. And they're looking, the WHO would be happy if something's 50% effective. I know in the US, we're looking more at least 70% effective. So we'll be looking for that. We expect in older adults, usually these vaccines don't work quite as well. But if you average it out, you'll get around 70% effective.
And is it the NIH, the CDC, the FDA, who makes the final call on efficacy in the United States?
It's probably going to be a variety of groups. It goes through several stages of review, and I think at this moment they're also going to debate, should we put all of our efforts in trying to prevent infection, or as I mentioned, would they be willing? These are unprecedented times. Usually they would want a higher level of efficacy, but I think at this point, anything that makes the situation better, but is not so weak to the extent that people who are vaccinated think they're invulnerable and start getting engaged in risky activities. So they'll be weighing those factors to determine, what's an ideal vaccine candidate. I mean, most of our standard vaccines, measles vaccine, it's 99.9% effective. And I mean, that would be our ideal, but in looking like probably we'll see something more similar to the flu vaccine that has lower efficacy, but if enough people use it, it can stem transmission in the community.
Got it. Thank you for all that. Appreciate it very much. Frederick in Solana Beach says, what are you doing as a member of the House of Representatives to help protect the integrity of the voting process in November's presidential election? Frederick, I worry about this all the time. Had a chance to see the president's interview on Axios yesterday, where he spoke about this, and I've seen repeated comments about the supposed problems with vote by mail. We've got a darn good reason for people to vote by mail or vote at home this year. We're in the middle of a pandemic. People should not have to choose between their health and voting. So we know that it can be done safely and without any evidence of fraud. I am extremely concerned when I see these sorts of comments. And we also want to provide resources to those secretaries of state to make sure they have what they need to carry this out in a safe and responsible way. And again, the Brennan Center from NYU School of Law, a nonpartisan group, came out with a number of $4 billion needed to do this right, along with some suggestions on how that money may be spent. We've already allocated $400 million in the CARES Act back in March. So that's the bare minimum that secretaries of state have. They need that other $3.6 billion, and that's what we're asking for, and that's what we included in our HEROES Act. The Republican proposal has zero. Just the same, standing up and protecting the United States Postal Service. There's so many reasons to protect the Postal Service. 630,000 Americans work at the USPS. Over 100,000 veterans work at the USPS. 48% of the world's mail is delivered through the USPS. And of course, that includes things like life-saving medicines, and all of the medicines run through the VA for our veterans. All of those reasons are so important. Add to it the need to have a safe and secure process by which ballots can be mailed and properly received and counted. When I hear Louis DeJoy, this appointee and big donor of the president, who has told some post offices not to pay overtime and to allow mail to be delayed for weeks at a time, it's crazy to think about the impact this could have on the election. So we've asked for a $25 billion lifeline for the USPS to get through this pandemic. We know that they've lost, by their own estimates, $22 billion as a result of the pandemic and counting. They were, as we discussed at the intro, in pretty dire financial shape even before the pandemic began because of some bad policies that were put in place around 2007 around both revenues and liabilities. So this is of great concern, and what I would just recommend for those who are voting by mail is to get their ballot in early. Get it in early, because that will help alleviate whatever stress there is on the U.S. Postal Service as the election nears. So we're going to continue to fight for a secure election, a fair election, a transparent election that I know we can have if we work together. And it should not in any way, shape, or form be a partisan discussion. We all should care about a secure and safe and accurate count. And that's what we're all going to strive to see in November. Here's one from Sandra in Oceanside. Dr. Brower, why are other countries doing so much better than us at keeping the virus under control?
Oh, Sandra, good question. Yeah, the U.S. has 4% of the world's population, and I was watching a report today. We have about 25% of the world's cases and around 22% of the world's COVID deaths. So definitely you would expect a country as strong and creative and scientifically strong as the U.S. that we would be doing better at this stage. And I'd say I'd probably flip the question the other way. You know, what are other countries doing that work that maybe we should take a closer look at the U.S. and make sure that we're following their example? One thing, countries that have been able to get their COVID outbreaks under control, they had rapid and tremendous testing and tracing, especially in Asia, where they had previously been devastated by the SARS pandemic in 2003. So countries like Taiwan, Singapore, South Korea had extremely fast responses. And the U.S. had a good plan for pandemic preparedness. One of the best in the world. It was just probably not the resources behind it to enact upon it. Other countries have had really strong, coordinated, centralized responses based on science. Australia is an example, New Zealand. In Canada and Europe, one thing that's helped is social supports and universal health care. So people don't have any concern about getting tested and having subsequent medical costs. So as you can imagine, in a pandemic, that's not something you should be worrying about. There's also other countries have tied some of their healthcare measures with large stimulus packages to be able to help support people who might have difficulty staying home. New Zealand spent 17% of their GDP on stimulus packages already. And I read somewhere Singapore spent 20%, and I know a number of countries have had large incentives. The U.S. has had some great packages, but as we heard from the representative, we need more, and it's obviously something that I'm sure will pass soon. And then finally, I'd say that keeping things shut long enough is essential. Italy, at one point was the worst in the world as far as the COVID. And at the moment, they're one of the best in Europe. And it's because they shut things down really strongly. They enforced masking and other measures, and then they waited until that curve wasn't just down, but it was really, really low, to this point where once they began to open up, that it would not overwhelm the public health system to trace any new cases that arose. So if you remember at the start of the pandemic, California kind of preceded New York by about a week in shutting down a lot of things. And we did at the start much better than New York. New York unfortunately saw this, horrific rise that kind of mirrored what had happened in Italy. And unfortunately, with something like an infectious disease, just a week can make a big difference as far as exponential rise in things. So just kind of keeping some of these lessons in mind from other countries and how they can apply to the U.S. Testing is essential, and we really need a coordinated effort, ideally nationally, with consistent messaging and ways to get rapid testing so we can all get back to our lives and back to work. Also, stimulus packages to support those who are not able to work or who feel obligated to work in dangerous circumstances, and having the patience to keep protections long enough to keep using that mask even when numbers go down in your community, or if you feel that you may be in a group that isn't particularly vulnerable. This inconvenience now is going to really make things so much better for us in the coming months if everyone would just go through wearing masks and social distancing in the coming weeks.
You did bring up one thing that I wanted to mention, was that, we have heard anecdotal stories from folks, claiming that the expanded unemployment insurance has disincentivized people to go back to work. There was, and I've heard that myself, candidly, from some of our small business owners, and I think they're well-intentioned in their comments, but there was a pretty important Yale study recently called Employment Effects of Unemployment Insurance Generosity During the Pandemic. They conclude that workers receiving larger increases in unemployment benefits experienced very similar gains in employment by early May relative to workers with less generous benefit increases. People with more generously expanded benefits also resumed working at a similar or slightly quicker rate than others did. And as they say, the professor behind this, the data do not show a relationship between benefit generosity and employment paths after the CARES Act, which could be due to the collapse of the labor demand during the COVID-19 crisis. They also go on to say, if the enhanced benefits had these effects, the data should show a significant drop in employment in the week after the CARES Act took effect. It should also show subsequent decreases in relative employment as workers with more generous unemployment benefits put off returning to work. The data did not yield results that support these predictions. So I think that's important as we consider the ongoing discussions around expanded unemployment insurance. With that, I wanted to give you both, I'm so grateful to you both for all the work that you're doing. Two of the most important things right now happening are the census and dealing with COVID-19. So your appearance here is so timely. Thank you for taking that time. I wanted to give you each an opportunity for any closing comments that you might have. And I wanted to start with Benita. Thank you so much for all the great work you're doing, Benita.
It's my pleasure. I just want to let everyone know, not just in District 49, but everyone across the country, please take the census survey. If you care about the well-being of your neighbors and your family, please participate. It's mandated by the United States Constitution, and we want to all adhere to that, just like with the COVID-19. We want to adhere to, all the mandates that are in place, because it's only beneficial to the masses, and we want to make sure that we all get counted.
We've got to get counted, Benita, and a lot of the benefits that we've seen from federal investment, and specifically a lot of the federal dollars that have come to the district since the pandemic, those are perfect examples of the types of things that are directly related to census data. So the more people fill that out, the more federal dollars we're going to be able to bring to our district, to our community in the years ahead. And so very important we get the numbers up. Hopefully we're going to hit 70% the next time I see you, hopefully higher than that. But get in your census form, call your friends, your family, your neighbors, use social media, whatever other means you've got.
Hold census parties.
Hold census with proper.
Oh, excuse me. No. Hold virtual
Zoom.
census parties.
Exactly. We could do Zoom census parties. We don't want to get Dr. Brower upset at us.
Sorry.
But I know what you meant.
Yes.
But I want to thank you, Benita, for all your great work. And we look forward to having you on again in the weeks and months ahead as we get the census numbers up. Dr. Brower, thank you so much for your great work and your leadership, and very difficult time for everyone in the public health space right now, but we're so grateful to you. What closing thoughts do you have this week?
Well, my first thought is in regards to the census, actually. You may not realize that for public health, we use that census data a lot to look at things like neighborhood factors related to health conditions and health equity. So in addition to all the benefits you can get from, increased investment in our community by filling out the census, it really helps with public health research as well. So another plug for the census, and have those virtual census parties or outdoor mass census parties, whatever it takes. And finally, in regards to COVID, I would say, this is a time in history when you can make a huge difference without very little effort. Just staying home is a huge difference. Wearing a mask is a huge difference. I mean, during World War II, people made great sacrifices for the country, for the good of the country. And it took, years and years of these sacrifices. Hopefully, we're facing something on a much shorter time scale. And the types of sacrifices that most people have to make are not that bad, except for the economic ones that I'm hoping Representative Levin will help ameliorate along with the rest of the Congress. But really think about masking, social distance, and it's not really social distance, it's physical distance. We can be together socially on the phone or waving to each other, to our neighbors. So just keep those things in mind. Keep up the good work that some of you've done already. And for those of you who haven't been quite keeping up with it, just realize you can make a big difference if you would start adhering to these practices.
Well, thank you both so much. I appreciate, again, your joining us. For all those watching, wear your mask. It's so simple. Practice social distancing. And just try to use common sense. It's not just about keeping yourself safe. It's about keeping others safe as well, and just showing basic respect and kindness and decency for everyone else. And I know that most of us are doing that. I hope that we all will recognize again that this has nothing to do with ideology as much as it has to do with the virus. Really doesn't care, what our ideology is. We just have to follow the science, and the data suggests that these are simple yet important steps that we can all take as we try to get back to this new normal. But again, please follow those guidelines. I'm going to do everything I can, again, to help our district, to help our country get through both this public health crisis and this economic crisis, and stand ready, as I said, on 24-hour notice to head back to D.C. for that 5th COVID relief bill that I hope we have in place very soon. Fill out your census, again, 2020census.gov. And we thank you all again. I'd like to thank my whole team, our Chief Kara and all our great staff in DC, our Comms Director Eric, Legislative Director Jonathan, our entire staff, and then in the district office as well, Francine and Kyle doing such a great job trying to get through this backlog of so many constituent cases, so many of our constituents hurting and needing help during this time. So truly grateful to them, and Shannon and Andy and Gabby, and really just the whole team working, I think, virtually, but harder than ever, if that makes sense, to try to serve the needs of our community. And thanks as always to Jeremy, our great video conferencing guru, for bringing us all together. Stay healthy, stay safe. Thank you all for watching, and we'll see you next week.